Hey guys, my name is Dan. I'm a veterinarian and welcome to the channel. Today, what is this? Check this out. I got a video the other day in the veterinary hospital off the microscope. So this is something, and I'm not going to spoil it for you. Try to guess what it is, but it is a parasite and it's wiggling through the blood vessels. And check this out. It's just like back and forth, wiggle, wiggle, wiggle. It's pretty remarkable, and I knew what I was getting into before I put this on the microscope slide. What I did, guys, is I ran a test, confirmed the test was positive, and then to confirm it again, I then drew some blood from the dog's right front leg, and then I put it on the microscope. And thank you, my licensed veterinary technicians, for giving me such a beautiful slide to look at, and then they recorded it for me for this video. What that is, guys, is that is heartworm disease. Heartworm disease starts off as these little worms or microfilariae that wiggle around through the blood, and heartworm disease comes in a couple different stages. I like to call this stage, guys, the baby stage, and this is why you take your heartworm prevention, because if you have the baby stage, these little worms wiggling around, and guys, there are tons of these worms in the blood, and they are microscopic, and they are just flowing through circulation, going to the toes, the fingers, going everywhere. And once they land in the heart, they try to grow up. They try so hard to grow up because they have a heart for the heart. And once they get there, they go into the teenager stage and the adult stage. And then you know what, guys? Once they're there and they're that old, your heart preventative will no longer treat them. You are out of luck. So when they're in the microfilariae stage, this stage right here, the baby stage, this is when you want to treat them. And the way you do that is you do your heart preventative, your once a month pill, or your once every 6 months or 12 months ProHeart or heartworm prevention injection. And all of these will do a fabulous job, guys, at keeping your dog's blood clean and preventing heartworm disease from showing up in the heart. Now, in this case right here, this doggy is a rescue doggy, very sweet doggy. We are asymptomatic, which means we have no symptoms yet. Thank goodness. There's no coughing, there's no breathing hard, there's no fatigue, there's no passing out. There's no indication the dog has heartworm disease, but the rescue knew it because they got this doggy from a bad situation. They tested him, brought him in here, I confirmed it, and now we're going to treat him. Heartworm treatment, guys, is pretty straightforward. We tend to do some doxycycline to reduce Wolbachia bacteria, and then we also do a steroid to reduce inflammation in the lungs, to prevent any secondary like widespread inflammation from the worms dying off. We start the heartworm preventative, and then over about a 90-day period, like we wait a couple months, we give the first injection of heartworm treatment. That kills off a lot of them, but not all of them. We wait another month, and then we go bam, bam, and we do 2 more for a grand total of 3 injections. This is pretty uncomfortable for the doggy, but by spacing it out and pre-medding them with different medicines like antibiotics and steroids, we can give this doggy the best chance for survival. Alright, guys, hope that video is pretty cool. I think it's always exciting to see a heartworm because I know if I find it early, I can treat the doggy and hopefully make them better. Alright, guys, as always, my name is Dan. I'm a veterinarian. Put your dogs on heartworm prevention, guys. It's a real thing and it's a real problem. You guys take care.